welcome to Point of View, where we give students a place to listen, learn, and lean in. We're your hosts, Jonah,
Avery,
and today we'll be talking about mental health. We will be discussing topics related to depression and suicide, and if these topics trigger you, perhaps try listening to a different episode of ours.
What might have caused this mental health crisis? Over the last decade, mental illness and mental health problems have risen around 47% among millennials, 65% among young girls, and 47% among young boys. The biggest spike for this percent happened between 2019 and 2021, when the world went through the global pandemic of COVID-19. During this time, the most mental health conditions that spiked included anxiety, depression, and self-harm. It's suspected that because of schools closing, teens and students were lacking the interactions they needed to avoid feelings of stress and loneliness. During this time, social media and media in general sparked some concern, as it was misleading and did not give accurate information on what mental health was. After using electronics and social media, addiction typically occurs, and this addiction can lead to poor sleep, which results in increased anxiety, stress, and depression. Because teenagers were trapped inside, this led to increased screen time and decreased performance in work or school and isolation from relationships. Signs of depression and anxiety. Whether you're looking for signs in your own life or in somebody else, you can look at feelings of sadness, restlessness, having suicidal thoughts, eating less, and sleeping problems. Depression can be a result of many things, including trauma, major changes in your life, or even passed down through the family line. Teens typically become more depressed from sleeping too little, eating too little, or too much, and losing energy to continue activities. Adults can see this through crankiness, loss of interest, and poor performance in school. Anxiety would feel like a sort of flight or fight feeling and out of control and anxious. Some signs also include irritability, shortness of breath, muscle soreness, and trouble concentrating. Others may be able to recognize it from others by seeing their nervousness, restlessness, or even if they have panic attacks. Everybody is able to cope differently and use different resources and help themselves, and it really depends on what is best for the person. It's important to make sure you are using healthy coping mechanisms for mental health, because things like drugs or alcohol or spending money and making bad decisions as a way to cope is not overall going to relieve your stress and make you feel better. Some recommended self-care / coping mechanisms are quality sleep, being physically active, involving yourself in a sport, and creating routines to make you feel in control and balance. It is also important to make sure you are taking care of yourself throughout your mental health journey, whether it's treating yourself to something or just going on a walk. It all depends on what works best and helps you feel better.
According to the American Psychiatric Association, depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Unfortunately, depression is often misunderstood and bypassed. A common misconception is the belief that depression is not a proper illness. Lots of individuals fail to understand that depression is a serious illness that can greatly affect the brain. It can also cause the hippocampus to raise its cortisol levels, which can impact the development of neurons in your brain, according to the Transformations Treatment Center. Additionally, there is a frequent belief that those diagnosed with depression are just being quote-unquote weak or quote-unquote lazy, suggesting that they should just get over it or just stop. People lack the remembrance that depression is not a choice, just like getting sick isn't a choice, but just happens or is caused by something. This type of reaction can also cause people to not feel like they could talk to people or go to people for help. Finally, it is crucial to remember that depression is synonymous with sadness. Although sadness is just a symptom of depression, it leaves a long-term effect on the person's mental health. Challenging these stereotypes as a community will change the way depression is viewed. And depression is a serious mental health condition, yet it often goes unnoticed by others. The lack of understanding depression can have devastating consequences for those who suffer it. According to a study conducted by the World Health Organization, depression is the leading cause of disability globally, affecting over 264 million individuals. Despite its widespread presence, many people still fail to understand the severity and impact of depression on a person's mental and physical health. Overall, it is crucial for society to recognize the seriousness of depression and offer their support and understandings for those who suffer from it.
There is a youth mental health crisis occurring in America. By the end of today, 132 people around America will have committed suicide, 12 of those people being under 25. The youth of America are struggling, and these numbers are only rising. A common reason for this crisis is school. According to the newest data from the CDC, more than 1 in every 3 high school students experienced poor mental health during the recent pandemic. Nearly half of students felt sad or hopeless, while about 2/3 of these teenagers had difficulty completing schoolwork. This means that in a classroom of about 30 students, it's estimated that 10 individuals are struggling with their mental health. Unfortunately, however, not all youth get professional help. In fact, most youth in the United States who need mental health services do not get them. While school alone does not cause mental illness among youth, it is important for parents to recognize that certain school-related factors could trigger a mental health problem. For example, academic stress is a leading cause of mental health struggles in students. More than ever, adolescents and young adults feel pressure to go to college, pursue extracurricular activities, excel in their courses, and pass universal standardized tests. Some students feel like they need to balance and excel at it all. Mental health problems are known to disrupt a person's daily life and functioning, especially when left untreated, and school performance is no exception. As cited by the Suicide Prevention Resource Center, mental illness can affect a student's energy level, ability to concentrate, and their optimism towards success. Research also shows that depression and anxiety are also associated with lower grade point averages, and depression often leads students to drop out of school. Most mental health problems begin during the adolescent and young adult years, with 75% of mental illnesses emerging by age 24. Being able to recognize your mental health is extremely important for your well-being, health, and future successes. Mental illness is very common during childhood, adolescence, and young adulthood, and you are not alone in this, as mental health disorders are treatable. There is an array of treatments available to you. Early intervention strategies are effective, and the earlier you address mental health problems, the better chance you have at lasting success and good outcomes. As mental health awareness has risen, I personally noticed that one topic is discussed much less than others, that topic being men's mental health. Men struggle with mental health to the same extent as everyone, but there is a certain stigma around the topic that restricts men from getting the help they need. Men may not talk about mental health issues due to shame and societal expectations that are thrust upon them. Men are often raised from a young age to be tough and unemotional, which can make it difficult for them to seek help. The examples of prominent people coming forward to discuss their own mental health issues recently may help to change this attitude. Another reason for the stigma around men's mental health can be ethnic or cultural backgrounds where such issues are simply not talked about. In general, the public expect men to be strong and self-reliant. The fact that some males would rather take their own life than speak out is a testament to the toxic community that our society has created. But this can be rectified. By letting your friends know you're there for them and they don't have to be alone in their struggles, you can make a difference. This simple conversation could save a life. You could save a life. In addition, mental health is often portrayed as frightening, unpredictable, and hard to understand, meaning that people afflicted tend to be judged negatively or avoided. A study done in the UK found that 6 out of 10 people polled who have mental health issues said they spoke to someone about it. Whether it be a friend, family member, or therapist, they found help. But this also leaves the 4 out of 10 people who said they haven't spoken to someone about their mental issues, citing the stigma and worriedness of appearing weak as reason to stay quiet. This mental health crisis among men has disastrous consequences, as 77% of all suicides are committed by males. The number of male suicides would exponentially fall if the stigma around mental health was lifted, and they felt they could talk to their friends and family about the problems they're having. Manhood needs to be redefined. There must be a transformation in changing the American culture in which males are more comfortable expressing themselves. But if you're going through something and you feel alone with no one to talk to, the suicide hotline number is 988. There is hope for our communities. By doing simple things such as comforting a friend when they're down, telling them they're not alone, and opening your heart to people you might not even know, you can be the light in their darkness. This concludes this episode of Point of View. Thank you so much for listening. For a transcript of this episode, head to the Point of View tab on our website, nhsmessenger.org, and follow us on Instagram, Twitter, and Facebook at NHS Point of View for updates and new episodes. We're your hosts, Jonah,
Jordan,
and Avery.
And this has been Point of View.